So sometimes it can feel like I'm in high school, it's med school, and also it's so far away. But what you're doing now, you're building foundational blocks that may help you and may open doors in the future.
Hi, and welcome to the RootSquare7 Podcast Career Conversation Series. And joining us today is my very good friend, Dr. Carl Lambert, who is a family physician and also an associate professor here at Rush Medical Center. I think I got that right. So to lead things off, can you just tell us a little bit about yourself and then kind of lead that into, talking a bit about your profession as a family physician?
Sure, yeah, just a little bit about myself. So my name is Carl Lambert. I'm oldest of three kids, and I think that's significant in my journey because I have two younger brothers with autism. So very early on, I kind of got exposed to physicians, like my parents taking us to, oddly enough, Rush. So very full circle experience working at Rush when a lot of my brothers' care, especially their specialty care, was at Rush. So I got to see firsthand how doctors did things. Like, they were personable, they were smart, there's human connection, there's a little bit of like detective work and just working with people to achieve a goal. So I like that. That really did appeal to me. So that was kind of like my um, first thoughts about pursuing something like medicine. I just like that doctors are able to wear a lot of different hats. So you teach, you advocate, you guide, you're a confidant, you hold people's secrets. It's a very special position to be in. So that was like one of my first inklings.
Okay. And then can you talk more specific as it relates to what you do?
Yeah.
Like what are some of the things a family physician does in terms
Oh,
of
yeah.
patient care?
Absolutely. So family physicians are really under the umbrella of what we call primary care. So a lot of times when folks ask, like, who is your doctor? They usually mean who is your primary care doctor. So we are the ones where, like, you think about football, like folks think about football, you pass the ball, but it always comes back to someone. So we're kind of like who the ball comes back to, right? We're the ones that usually are managing a patient's healthcare plan. So if you have chronic health conditions like high blood pressure, diabetes, asthma, whatever it is, we help to manage those conditions directly, or we do it through collaborating with other specialists or other folks on the healthcare team. That could be social work, nutritionists, psychologists, physical therapists, speech therapists. It just kind of depends on what's going on with that patient. Then the other piece of what we do is really preventative care. So that's around, are you eating your fruits and vegetables? Are you getting proper rest? Think of like maintenance on your car. You usually go after so and so miles.
Right.
There's certain things you got to check. Same thing with the human body. So usually like once a year or several times a year, I'm checking patients to make sure cholesterol is okay, blood pressure is good, that they're not at risk for chronic conditions that can decrease how many years of life or quality of life that they'll have. So that's a lot of what we do. So we meet patients who may have never seen a doctor before. That's what we call like the undifferentiated patient. So we don't know anything about them. We kind of create a plan out of nowhere and start plugging them into resources that they may need.
Okay, sounds good. So you mentioned that the issues with your brothers kind of give you an idea of that you want to pursue the medical field. Was that before or at the time of high school?
That was before high school. That was grade school. And I had teachers, like I had wonderful teachers in grade school that even encouraged me to pursue like STEM careers. So they saw I had an interest in science and math and had an affinity towards it and an interest. So they kind of steered me towards opportunities. And even high school, I applied to go to a school outside of my district. It's called the Illinois Math and Science Academy in Aurora. So from the name, you can kind of see what it's about.
Right.
So I applied there. Really interesting process. You had to take the SATs and all this other stuff. It's really just to show that you had like some aptitude to do this. So it was probably one of the best decisions I could have made, and was really formative in terms of getting some of those skills to get towards, a medical career.
Okay.
Yeah.
And so you talk about the school you went to was STEM.
Yeah.
Can you speak to more specific courses, even at the high school level,
Sure.
and then walk us through like the college level, like what type of programs and courses that one will have to
Yeah.
undertake to pursue such profession?
For sure. So the first thing that comes to mind is the MCAT. So like that's the medical college admissions test. Like you have to take that test. That's one of the criteria for you even to apply to medical school. So you have to have a very good grade point average, which I'm sure students know about. Mainly your undergrad grade point average, but even high school, you want to have a good grade point average because that gives you options, better options for colleges that can put you in better position to get into competitive medical schools, right? Um, but backtracking, so for the MCAT, there are certain coursework that can help you to do well on that. So even back in high school days, you got to think about, well, what are some of the things that physicians need to know about, right? Some of those hard sciences and such. So biology, like general biology, cell biology, and anatomy and physiology, that probably be more of like a college course or an elective. But general chemistry in college would be general chemistry. Some high schools you'll do general chemistry, physics, and biology. Those are kind of required. And then, of course, in high school, I'm thinking high school now, you probably do algebra. Some high schools even do like calculus or pre-calculus that can be very helpful. And then I think about not just math and science, but it's important to be a well-rounded person. So you can take the humanities, you should know how to read and write and, to articulate your thoughts and have different perspectives and critical thinking and abilities to analyze things. So the MCAT tests that stuff too. There's a reading comprehension part on there as well.
Right.
So some of that's in high school, and then undergrad is more of the same. So if you didn't do some of that stuff in high school, it's even more important to do it in undergrad. And then another important course that's really specific to undergrad is organic chemistry.
Okay.
So that's really like the chemistry within the human body, like how enzymes work. That's just it's what we call a weed out class. So that's a test that unfortunately can take a lot of folks out in terms of like getting to medical school. So it's a course that's difficult, but if you can do well in that course, you generally can do well in medical school. So there's that. Again, anatomy and physiology in college. Biochemistry is another course that you'll even take in medical school. That is just it kind of builds upon organic chemistry concepts. So physics is also a test that you have to take because that's integrated into the MCAT as well.
Right.
And I would want students to know that you don't necessarily have to major in a science field.
Okay.
You don't have to be a biology major or a chemistry major. You could be a English major or Spanish major, but you have to take the prerequisites.
Right.
So even if you do that, you have to take your biology courses, your Gen Chem, all that stuff. So I would advise folks to, if you have a pre-health advisor, like you might have a general college advisor, make sure your school has a pre-medical or a pre-health advisor that can make sure
Right.
that you're hitting those courses so that you're prepared to take that test no matter what your major is.
Okay.
And they can help you to build your resume
Right.
and all these other things that schools look for, like community service, clinical experiences, volunteer work, those things of that nature.
Okay. Okay. So you kind of answered my question. That was my next question as to what specific major one needs to pursue at the undergraduate level. So you did answer that. So let's talk about beyond medical school now, or I don't know if you want to kind of talk as it relates to applying to medical school, and then after that, if you could speak to after medical school, what's next? Because I've met a few people, they have medical degrees, but they're not actually doctors. So can you walk us through those processes?
I can. So after undergrad, there's a variety of things that can happen. So one of my roles here at Rush is actually I sit on Rush Medical College's admissions committee. So I read, screen applicants, interview folks every week, and vote on who gets in. So I got a lot of wealth of experiences in this sort of piece. Um, I'm seeing all the more that once folks finish undergrad, that they don't necessarily go straight to medical school. I did, but I graduated in 2011, so it's been a while.
Right.
It's not that common for folks to go straight through, though it can be advantageous from a financial standpoint, right? What I'm seeing now is that folks are kind of taking a more non-traditional route where they might do undergrad, and then after that, they kind of get work experience. So they might work as a medical assistant for a couple years. They might work as a scribe or a EMT,
Okay.
so emergency management technician, like on ambulance rides and stuff, just to get more direct patient care experiences, not just shadowing,
Right.
but like you can actually speak to that you've kind of tested
Right.
the hypothesis that, hey, I know a little bit about what the healthcare career in medicine is going to be.
Right.
I've had some experiences and I can articulate about why I think I'm ready for this. Sometimes it's hard to get all of that with undergrad, though many do. But it's not frowned upon for you to take what's called a gap year
Okay.
or two Some folks even take a gap year to improve on their GPA or to retake the MCAT. So there might be what we call like post-baccalaureate programs that help to get you more academically ready for the rigors of medical school.
Okay.
So that's one kind of caveat.
All right, before we move on,
Yeah.
so all these experiences,
Yeah.
whether it's a gap year or whatever,
Yeah.
do they count as towards a transfer credit, or what benefit would they provide the student as it relates to applying to the
Yeah.
medical program?
It's I think of it as like you're building a case for yourself. So it shows evidence like, hey, yeah, my GPA might have been like 3.5 in undergrad. If you do a post-bac program that's really focused on medical school courses and you get like a 4.0, it shows schools like, hey, you have an upward trajectory in your academics and that there's not a risk that if you were admitted that you wouldn't do well with the courseworks. Because the first 2 years of medical school is really schools, really classes. You might have some clinical experiences, but mainly it's you're in the books. So they want to make sure that you wouldn't flounder and that you can handle that. So when you're kind of building and beefing up your resume just to show schools like, hey, I'm aware that there might have been some missteps or setbacks, but I've reinforced those and now I'm ready. So
Okay.
that's kind of how I think about it.
Okay. Okay. And then talk about like beyond medical school
Yeah.
now, because like I said, I've met quite a number of people. They have completed medical school, but they
Yeah.
still tell me, "Hey, I'm not a doctor." So can you talk about?
Yeah,
Yeah.
very interesting. So when you finish medical school, you do get an MD or a DO, depending on the school you go to. But the next step after that really is residency. Because if you don't do residency, you technically can't really practice medicine. So residency is really like on the job training. Throughout medical school, you have to apply for residency.
Okay.
And that's really specialty based. So I'm a family physician. That's just one specialty of many. You would kind of like declaring a major
Right.
in college. You kind of declare a specialty, or you say, hey, I want to go into pathology or emergency medicine.
Okay.
So then you have to apply to different residencies during your fourth and final year of medical school, and you would do interviews. And there's this process called the match where you rank programs that you're interested in. And then those programs rank you and other applicants throughout the US. And there's this really complicated algorithm that pretty much pieces it together, and then they determine who will actually be in that entering residency class. Some medical students don't get matched, right? So they may have to do some other stuff. So they may have to do extra work on the side. They could work as an intern or do, work under the supervision of a physician. Or some folks will do a 1 year kind of beefed up program and then reapply.
Okay.
But vast majority of students, they want to get into a residency because if you don't go through that, you can't get board certified,
Okay.
right? So there's all these, there's credentialing that's involved to make sure that, you're legitimate, that you're not just saying you're a doctor, but you have no proof of that. So there's 3 steps to that in the US, and then there's specialty related board exams to show that you're legitimate and that you can have hospital privileges and that you wouldn't cause a hospital or a healthcare center to be sued. You know what I mean?
Right.
So I guess I'm getting lost in your question. I want to make sure that I'm
No. You're doing good. So let's step back a little bit because I've always thought that like someone wants to be a gynecologist and not a family physician. It's not at medical school. It happens at residency.
Yeah,
Oh,
so
okay.
so in medical school, it's almost like you get a sampling. Like during your 3rd year of medical school, that's when you do what's called your core clerkships. So you spend a month or 2 with different kind of major, just common specialties. So you do a month in primary care with me, right? You do a 2 months with surgery, 2 months with internal medicine and hospital medicine. You do 2 months with OB-GYN. So there's some that are required.
Right.
Then 4th year, you would do like elective rotations, like emergency medicine,
Okay.
or you may go to a different hospital that you think you want to go to residency at.
Right.
You might do a rehearsal rotation to show them what you can do,
Right.
to show that you're a good worker and that they should technically employ you as a resident. So you get a sampling of that, but once you declare, you're going to do really coursework and rotations that are going to make you ready to be a board certified,
Okay.
fill in the blank,
Okay.
whatever that specialty is.
Okay.
Yeah.
So for the board exam, it's required, and how many times do you have to take it? Is it annually, or it's once you take it one time, it serves for a lifetime?
Good question. Thank God it's not annually.
Oh.
And every board is different. So I can give you mine for the American Academy of Family Physicians or the American Board of Family Physicians. Right now, you could do it every 7 to 10 years.
Okay.
If you remain in good standing, there's certain things you got to do over those 7 years, like what we call continued medical education. So that might mean reading so and so many journal articles, going to so and so conferences. There's certain things that you can show to the academy that you're keeping your skills up. So, like teaching students, which is what I do here at Rush,
Okay.
that counts towards being legitimate so that I can take my boards at 10 years. So then it used to be you would sit down and take like a 7 hour test. Now, they've kind of relaxed that where you can kind of do it at home and they break it up into like 25 questions per quarter,
Okay.
to kind of make sure that you're,
Okay.
doing well.
Okay. Is the certification state specific or it's cross
That is
border nationally?
that is nationally.
Okay.
And most other specialties are about the same. They may have different frequencies in which you have to do that. Some might be every 3 to 4, but for our specialty, they've relaxed it to 7 to 10, which I think is a good move.
Okay. And then what are some things like within the profession that the classroom never taught you? Can you share that? And then, and in answering that as well, did you have mentors, and what role did mentoring play into you being successful?
Well, the mentoring is huge. I think I'll say specifically as a person of color, right? It's not a lot of us in the healthcare field. I think it's less than 3% of are African American, right? So it's important to seek out mentors that can save you time so you don't have to make the same pitfalls that others have made. They can save you a lot of time and heartache and frustration. They can tell you, like, they can look at your personal statement, they can look at your application and make sure it's up to snuff. They can help you practice interviewing. You do have to interview for medical school and residency to make sure that you come across the right way. They can help you to network with other folks to give you opportunities to bolster your resume. They can sponsor you. So sponsoring is essentially they will speak highly of you even when you're not in the room. So it's important to have a mentor who's kind of like a coach,
Right.
and then the sponsor can help you to kind of get to the next step.
Right.
So some folks will be both of those things, but you might have two separate folks. So it's important to find a mentor and then to be a mentor for someone else once you get through a door. So you have to have one. And I often tell students, have a board of directors. So you might need a mentor for research, for clinical work, for academics, for marriage. Eventually so you need several people to help you out to get along the way.
Okay.
And then what was the first question you asked?
So it was, so I was asking, like, what are some things that you learned while performing your job as a physician that what are some things that the classroom never taught you?
One thing that the classroom didn't teach me was like the business side of medicine,
Okay.
right? Law schools don't really teach you about how are doctors paid, how are you compensated, what are the different payment models for that.
Right.
That's important, to just know how to negotiate for yourself. Like when you get a job, eventually you're going to get a contract, and you got to like make sure it's cool and no one's trying to get over on you. Mentors can help you with that too, but it's important that you have some knowledge around that.
Sure.
Another thing is you learn a lot about like leadership along the way. Like you learn how to manage staff, how you manage your own patient, panel. That's what we call practice management skills. So you get some of that in residency, but you really get it when you're in practice on your own. Like how do you manage a panel of 1,000 or even more than 1,000 patients? How do you make sure you have systems in place to make sure people get what they need? How do you make sure that the things you're focused on are really what the doctor should be doing,
Sure.
not versus a nurse or a medical assistant or someone else. Like you learn how to delegate and just self-care and time management. So you really, really learn how to balance things, especially because now you got family, you got other things outside of work that are just as important, maybe even more important to you.
Yeah. And it can be a stressful job as well.
Yes, it can. So you learn that you are not Superman, you're not Superwoman. You can only do so much, and I feel like I've kind of learned that through making mistakes and never making those mistakes again, or having mentors or even like my wife that they can help me see blind spots to say like, hey, you're doing a little too much, you're overextending.
Yeah.
How about you,
Okay.
not do too much.
Okay. So mentors as accountability
Yeah,
partners as well.
accountability, coaching, they can reaffirm you.
Right.
Sometimes you can be hard on yourself. Mentors can be like, yeah, you messed up there, but it's not over.
Right.
So they can be authentic and keep you honest, but also just remind you that you're still where you're supposed to be.
Okay. Okay. So in the introduction, I kind of mentioned you with two titles, family physician and then an associate professor. So can you tell us real quickly, how did you pivot from, being a physician into actually teaching now?
Yeah, yeah. Thankfully, I'm still able to do both.
Yeah.
So, and that's the cool part of like if you're in academic medicine, it's like this pie chart. You can kind of pick how much of your pie you want to do different things with. So, that sort of flexibility and variety helps to add color to my work and it helps to decrease the risk for burnout in what you do. Um, I've been a associate professor at Rush for about 10 years. This will be my 10th year teaching. And it really was just like a leap of faith. I was doing clinical work out in the Southwest side near my hometown. And after about 2 years, I got a little burnt out. I was doing good work. I was working with underserved populations, but it was a lot. And I felt like I was supposed to be doing more.
Right.
And I always had a passion for teaching. And I would find myself trying to do that in the clinic. And it just so happened that Rush was changing their curriculum around to what's called a flipped classroom approach.
Right.
So as opposed to just sitting in lectures all day, you're actually going to go through cases together with the professor.
Okay.
And that really appealed to me. One of my former teachers, they reached out and said, "Hey, would you be interested as we revamp this?" And I said, I took the leap of faith and said, "Yeah, let's try it out." So a lot of learning on the ground. It's almost like trying to assemble a plane as it's going. Eventually there's a lot of turbulence, but you kind of hit that cruising altitude and you figure out what you're doing. So that it was really a leap of faith that kind of led me to integrating teaching scholarly work with.
Okay, so I kind of take from that that not only figure out your purpose in terms of a profession, but think of how as a purpose where you're meant to serve. So
For
that's
sure.
okay.
Yeah, absolutely. So I mean, I think medicine and a lot of what we do, it's a calling, you know, um, and you have to be sensitive to what, if you are of a spiritual leaning where God is calling you to go. And I felt like that urge, like it felt like there was a door that was opening that I couldn't avoid. It's like it's a little scary, but this is the way you should go.
Sure. And then finally, so two sets of advice. So first advice is provide some additional advice to those students who are in high school who are contemplating, pursue the medical field. And then also for students who are in college, who is en route to pursuing that profession as well.
Yeah. The first thing kind of applies to both of those groups is like what you do now matters for tomorrow. So sometimes it can feel like I'm in high school, it's med school, and also it's so far away. But what you're doing now, you're building foundational blocks that may help you and may open doors in the future. The next piece is just to remember, like you are needed. If you feel like that's in your gut, or you feel like this maybe divine, unction to do it, go for it, and then don't be surprised if there's setbacks. A lot of times success is not linear. It's usually jagged, you know what I mean? But then 10 years or 20 years later, you take a more panoramic view and those are just blips. You're still making great progress. And that's kind of part of everybody's story. It's just being human that things don't always go to our plan, but if we're faithful and we are serious about our crafts, you'll get there. And making sure you have people that mean you well,
Right.
that they'll be honest with you. So be very discerning of who's in your corner in terms of who you choose to be mentors and advisors to you. And then I'm trying to think if there's anything else. I think those are the main ones. Like just think about one thing that would help me is I would think about just the patients I haven't met yet. Like when I was a student, like man, if I don't quit, there's gonna be all sorts of patients out there that I haven't even met yet that I'm gonna be able to touch. And by God's grace, hopefully help them out along their way. So sometimes that can be a great motivating factor as you're in the thick of it.
Sure,
You
sure,
know.
sure, sure. Well, thank you, Dr. Lambert, for taking time out to share with us more insight into the medical profession. And thanks for joining us. And I hope that for those of you pursuing a medical career, that you'll find these insights very valuable. And we'll see you in the next episode. Thank you.